Remember when governments across Canada claimed to just follow the science with their lockdowns and vaccine mandates? Well, as it turns out, this science was really no science at all. Just last week, we had an exclusive in-house webinar here at the Justice Centre with Dr. Regina Watteel, who's a Canadian statistician, researcher, and author. Dr. Watteel has spent the past 5 years digging into the studies Canadian federal and provincial governments cited to justify their lockdowns and vaccine mandates. What did she find? She found that no study that governments cited was statistically sound. All of them were catastrophically flawed and really completely unusable. Many of us have known for years now that there was little, if any, scientific backing for government policies during COVID. However, according to Dr. Watteel, her work proves that none of the studies Canadian governments did cite was statistically sound. In short, they really did have nothing. In the presentation, Dr. Watteel showed 7 key statistical fallacies that injected critical flaws into government-cited studies. She explained how her findings amount to a, quote, statistical kill shot to studies cited by Canadian governments. Dr. Watteel holds a PhD in statistics, and her previous work includes teaching statistics at universities, serving as principal statistician at an Ottawa economics consulting firm, and leading risk-benefit analyses for governments at all levels. So when COVID hit, she noticed Canada's COVID response abandoned the evidence and the very risk management principles she had spent years enforcing on government contracts. So now, as an independent researcher, she dug into the government's own data. And the result? In 2024, Dr. Watteel published the Canadian bestseller, Fisman's Fraud, The Rise of Canadian Hate Science, and recently published a scientific paper, which is now under international peer review. She uses nothing but official Canadian surveillance data and reports to prove that COVID vaccine mandates rested on catastrophically flawed statistics, and often outright scientific fraud. But don't take it from me. Watch for yourself. Here's her presentation.
Thank you, Ben. Thank you for that introduction. And I'd like to thank everyone here for attending and for giving me this opportunity to share the evidence. So I'm going to go ahead and share my screen. Okay, does everybody see that? All right, so yes, I am a statistician, and my entire training is to figure out what data you actually need to prove a claim, check whether it exists, expose its limits, and never let anyone twist numbers to fit a story. So during the pandemic, we heard constantly from physicians and epidemiologists, but we rarely heard from statisticians, the one profession whose entire training is to judge the strength of evidence, to separate signal from noise and proof from story. So this afternoon, I'm going to do exactly that. So, sorry. Okay, using only official Canadian public health reports, their data, their footnotes, their own corrections, I will show you 3 things. 1, how the response abandoned the evidence from the very first month. 2, how 7 critical and catastrophic biases made every vaccinated versus unvaccinated comparison unreliable. And how, when real-world data finally broke the narrative, they pivoted to outright fraud in simulated benefits. So by the end, you'll see in their own words exactly how far the evidentiary standard was abandoned. So let's begin. Year 1, a response that ignored reality. So as soon as the pandemic was called, we almost immediately went into lockdowns, and this was an unprecedented first step. But within a couple months, they admitted that the fatality rates were grossly overstated, and they corrected these fatality rates. They collapsed to less than 0.3% by May of 2020. And that was overall. For people under 70, it was around 0.05%. So that's very comparable to the seasonal flu. So you would have thought there would have been a sigh of relief and a return to normal. But instead, we got plexiglass barriers, one-way aisles, universal mask mandates, behavioral science, fear messaging, second and third lockdowns, and reopening that was explicitly tied to vaccine uptake targets. So by the spring of 2021, we were conditioned to accept pretty much any measure as under the assumption that it was until the vaccines arrived. So year 2, we go from unproven claims to coercive measures. So when the vaccines arrive, we are sold on claims never tested in the trials, namely the reduction in transmission, hospitalization, and death. But really, the trials were only powered for symptomatic infection in the individual. And when independent researchers reanalyzed the original Pfizer and Moderna trial data, they found something the regulators never told us, and that is that serious adverse events of special interest, including death, outnumbered the reduction in COVID-19 hospitalizations. So that was a net harm signal. By May of 2021, breakthrough cases had become the norm, and people were hearing of serious adverse events such as blood clots, myocarditis, pericarditis, and neurological disorders. But did PHAC pause? No. Instead, they did back-to-back marketing campaigns to combat so-called vaccine hesitancy, and Canada secured 400 million doses. That's 10 for every man, woman, and child. And then came a resurgence in Israel. And that summer, they approved their boosters, and they warned other countries that 2 doses wouldn't be enough. We also saw massive outbreaks in mostly vaccinated venues. Yet Trudeau called a snap election, and he made vaccine mandates a wedge issue. The premiers also, within weeks, reversed their promises not to impose vaccine passports. So here we have coercive passports and federal trial bans were imposed on claims that the trials never examined and that the trial data actually showed net harm. So let's look at Canada's hospitalization counts. Okay, here we go. So this shows COVID-19 hospitalizations from the beginning of the pandemic through to the end of 2022. And what we see here is once 80% of the population was fully vaccinated, we have a surge in hospitalizations. At the peak, it doubled previous peaks, and it remained elevated throughout 2022. So this is opposite to the promise that they made that we would see a reduction in hospitalizations. And then when we look at cases, here's the cases over the same period from the beginning of the pandemic through to the end of 2022. Again, when 80% of the population was fully vaccinated, cases surged to record heights, 4 times previous peaks. So this again is opposite to what they had promised. They had promised a reduction in transmission. But this isn't the full story. The real scandal is how biases were baked into these metrics right from the start, and how they compounded over time to make the data completely unreliable for justifying mandates. So early on, before the vaccines came out, we had testing bias from high PCR cycle thresholds and the expansion to asymptomatic cases, and this inflated counts overall. We also had an issue with misattribution, that is, dying with COVID instead of because of COVID, and this made the risk look far worse than it was. Then, as the vaccines rolled out, the groups were compared to each other, the vaccinated and unvaccinated, with selection bias and misclassification biases favoring vaccination, and cumulative methodology was used to further distort comparisons. By Omicron, biases exploded, but even so, they weren't enough to save the narrative. So by mid-2022, they just stopped reporting the metrics entirely. So I'm going to take you through these, take a deeper dive into these 7 major biases. While each one on its own is quite substantial, together they turn the official numbers into whatever the government needed them to say. So we're going to start with selection bias and why randomized controlled trials are necessary. In short, they're necessary because they give comparable groups, so we can establish clean causation. And that is something that real-world data cannot do. In the real world, people self-select. And the vaccinated and the unvaccinated groups differ dramatically in their baseline health, their behavior, and their social economic status. So if you recall, as the vaccines were rolled out, priority was given to the elderly and to healthcare workers. And it was voluntary. So basically you get early adopters. And early adopters generally have proactive health behavior and better healthcare access. And this gives rise to a healthy vaccinee effect. And then mandates came into the picture, and mandates required federal workers to vaccinate, and it also impacted many white-collar workers, doctors, lawyers, university professors. Again, these are people who have higher social economic standing and generally better health. And then vaccine passports were required for post-secondary education to go on campus, for travel, and for things like theater, sports. Again, these are things that people of lower social economic standing could more easily forego. So the end result there is that the vaccinated group is associated with healthier individuals and better outcomes independent of the vaccine. So this is selection bias, and it is the most fundamental bias of the 7. So we need to get an idea of how big this bias is. So one thing I want to note is that this bias is recognized globally. And if we look at a study out of the Czech Republic, they showed that even when COVID-19 was negligible, the vaccinated had a 5 times lower all-cause mortality than the unvaccinated peers for the 45 to 95-year-olds. So what does this mean? It means with selection bias this severe, you cannot just adjust away the biases with statistical models. All right. In fact, statistical models can actually amplify or create new biases. So the only way to eliminate these biases is through properly conducted randomized controlled trials. All right. So when you see all those fancy models and you see them a lot, you have their propensity scoring, you have your logistic models, they cannot eliminate this bias. So I just want to give an example out of Canada that some of you may have seen. And this is an example of selection bias in action. And in February 2023, this study came out in a peer-reviewed journal. And researchers in Toronto wanted to look at the risk of a traffic accident of vaccinated versus unvaccinated individuals. And what they concluded was that unvaccinated individuals in Ontario had a 72% higher risk of serious traffic crashes. Well, clearly, just vaccinating isn't going to reduce your chance of a traffic accident. So this is a prime example of correlation does not equal causation. And really, the researchers should have warned about the perils of misinterpreting observational studies. So this goes to the whole correlation doesn't equal causation. But instead, what did these researchers do? They said that the observed risks might justify changes to driver insurance policies in the future. So just like that, they lose all credibility, and this journal should really be embarrassed. So we'll go on to the second bias, and that is misclassification bias. So this has gotten a lot of play in different reports, and most of you are probably familiar with misclassification bias. This graph is a graph of confirmed post-vaccination cases of COVID-19 by number of days between dose administration and symptom onset. It is for Ontario, and this is for the period leading up to Ontario's vaccine passports. So from December 2020 through September 18th, 2021. The passports here in Ontario came in a couple of days later on September 22nd, 2021. And people who showed symptom onset within 14 days of their first dose, they were misclassified as unvaccinated. And what this does is artificially boost the unvaccinated cases. This window was the same for almost all provinces apart from Quebec and BC, which used a 21-day window, making the misclassification even worse. Also, we have that people were not considered fully vaccinated until 14 days after their second dose. So what that means is if you get COVID after your first dose and before 14 days after your second dose, you will enter the vaccinated group with at least some natural immunity. So what this does is it artificially boosts early effectiveness estimates, creating a misleadingly high baseline that later declines. And that's the exact pattern we see. But how big is that bias? Well, here is the table accompanying that graph. And we see for the time period leading up to our passports that 41.2% of the confirmed post-vaccinated cases were misclassified as unvaccinated, and only 17.4% were considered breakthrough cases. So these are the numbers that informed Ontario's passports. And one thing that's worth mentioning is that together, misclassification and selective selection bias, it pretty much guarantees better health outcomes for the vaccinated, even if the vaccines had little or no effect on severe outcomes. And the misclassification bias, that was compounded by testing bias. So high PCR cycle thresholds, they basically turned dead fragments into cases. We also seen testing strategies shift to asymptomatic individuals. There are also behavioral biases. For example, people who got the vaccine may have felt they were protected and not been tested. And Public Health Agency of Canada did warn about this. There was also some workplace requirements for unvaccinated people to test. And then there was massive temporal and provincial variations. And these massive fluctuations, they actually destroy the reliability of the data. Just to give you an idea of that, here is Ontario's testing numbers from the beginning of the pandemic through to the end of 2022. You see a lot of variability. We see an increase in testing as the testing opened up to asymptomatic individuals. But then here in this green phase, early 2021, testing was through the roof during the first dose rollout. So that means lots of post-dose positives wrongly counted as unvaccinated during this time. Then this blue phase, the summer 2021, testing collapsed exactly when second doses ramped up. So breakthrough cases were conveniently underdetected before passports went live in Ontario at the end of this block. Then in this orange phase, late 2021, it coincided with the approval of the vaccine for 5 to 11-year-olds and the emergence of Omicron. And then at the moment, cases and rates are dominated by the fully vaccinated. Boom. The testing slashed by 70% within weeks, and it never came back. So this pattern, this testing pattern, it basically understates the breakthrough cases while capitalizing on misclassification. And this leads to completely unreliable metrics. So that's not surveillance. That's turning the testing faucet on and off to get the story that you want. Next, misattribution bias. So we'll start by what is a COVID-19 hospitalization? Well, these are people hospitalized with COVID. They're not necessarily in the hospital for COVID. For example, you might be having a baby, getting your broken arm fixed, but you happen to have COVID-19, test positive for COVID-19. So these are called incidental hospitalizations, and international studies show that these incidental hospitalizations range from about 10 to 67% across pandemic waves and measurement approaches. So in Ontario, they admitted that during Omicron, incidental hospitalizations were about 55%. So we have our COVID hospitalizations are capturing something other than hospital burden. We have a similar problem with COVID-19 deaths, people who die with COVID-19, not necessarily from COVID-19. And this is an issue because around 90% of Canadian deaths in 2020 involved comorbidities, usually an average of 3 or 4 additional causes of death. So it may not be because of COVID-19. And what this does is it renders hospitalization and death metrics completely unreliable and invalid. So to demonstrate this, I take a look at this graph. This is a graph of COVID-19 hospitalizations per 100,000 population in Ontario, and it compares hospitalizations in 2021 to 2022. And in 2022, we overall see about a 31% increase in hospitalizations. The biggest increase here is in the 80 plus age group. Note that we are rolling out the vaccines in 2021, but by 2022, 80 plus year olds, at least 95% of them were fully vaccinated for that entire year. So this is devastating to the narrative. We also see a big increase in infants under the age of 1, and the vaccine was not approved for babies in this age group until halfway through 2022. The only age group that we don't really see an increase in is the 20 to 59-year-olds that had relatively low hospitalizations to begin with, and that happens to be the group most impacted by vaccine mandates. So with this graph, authorities can either have to acknowledge that there's a huge misattribution bias or their vaccines failed, or both. The next bias, the fifth bias, is underestimation of the unvaccinated population. Now this one is pretty shocking. This is a key data flaw. So how did they calculate the unvaccinated population? What they did is they took the total population and they subtracted the number of people with at least 1 dose. The problem is that they were using outdated census data in 2020, 2021, and this led to negative vaccinated population sizes in some regions. And in those regions, the Public Health Agency of Canada, they just set the unvaccinated counts to 0. So this was a huge underestimate of the unvaccinated population, and it leads to inflated rate estimates. So in Ontario, they did correct the population sizes in middle of 2022, and then they found about 400,000 extra unvaccinated Ontarians, and about half of those were seniors. So I just want to show you what that does to the estimated rates. So we'll start here. These are the case rates. This is the Ontario COVID rates per 100,000. And it's over the period of the summer of 2021 to about March of 2022. And this is the only period really in Ontario where we have these statistics by vaccine status. So this is the official data, and it shows that the unvaccinated actually have lower rates, case rates, than the vaccinated during the Omicron wave. If we actually adjusted for the population size, we see that it lowers the unvaccinated rates even more, and it looks even worse for the vaccinated population. Now let's turn to hospitalizations. So here I have on the left side COVID-19 hospitalizations per 100,000 person days by vaccine status. And this was in the Public Health Ontario report for August 1st, 2022, and that was right before they made their correction. And we see that hospitalizations mostly affected people over the age of 60, and that these rates were dominated by unvaccinated seniors. But the report showed a number of 141.33 hospitalizations per 100,000 person days. 2 weeks later, they issued another report, but this time they used their corrected population estimates. And this is what we get. A collapse of the rates. It went from 141.33 to 3.6 in the unvaccinated senior population. And when I look at the reports from January of 2022 through to August of 2022, when they made their corrections, what I find is that hospitalization and death rates estimates for the unvaccinated seniors were off by 1 to 2 orders of magnitude. This is massive, especially when you consider that during this period, the narrative that was going out was that the unvaccinated were clogging up the hospitals and all the blame was going towards the unvaccinated population. I'll just show you how this looks for senior deaths. So this is a graph of COVID-19 deaths by vaccination status for people over the age of 60. The red line that you see here at the top are people who had 0 to 1 doses. This is a publicly available data set, and the population sizes were not corrected until January of 2023, at which time you see the senior rates plummet. So it's quite dramatic. So the sixth bias I want to talk about is age standardization. So age standardization is generally intended to adjust for age structure differences. So the vaccinated individuals had, on average, they were older than the unvaccinated. So a lot of experts claim that it's better to age standardize the rates than to make things more balanced. It's a more fair comparison. But before you age standardize, you have to ask a couple of questions. First, you have to ask, do we have accurate, stable estimates in every age band for both groups? Well, we just saw that that's a big fat no. Also, are trends consistent across age groups? Again, the answer is no. This is especially true for hospitalizations and deaths where you have the seniors risk several orders of magnitude above the youth. So when you do age standardization under these conditions, that is not a correction, that is a distortion. And by giving more weight to unvaccinated seniors, it artificially inflates the overall unvaccinated rates and it masks the low risk in the young. So I'm going to show you some examples of what this means, this meant during the pandemic. So here I have, again, Government of Ontario data, and this shows the case rates per 100,000. These are 7-day moving average, and it shows the rates for children, teens, and working age adults. These are people who were heavily affected by, the teens and the working age adults were heavily affected by passports and workplace mandates. And we see in all these groups that during the Omicron period, the vaccinated had much higher rates than the unvaccinated. So this is official Government of Ontario data. I did have to go on the Wayback Machine and scour it to get these graphs. The next slide, this is the overall case rates. I showed you this previously, and it shows overall the official Government of Ontario data shows the vaccinated had higher rates than the unvaccinated. Now, I want to show you what happens when Ontario Science Table age standardizes the rates. Boom. They conveniently inflate the rates above the vaccinated. So the Ontario Science Table, they basically use the high unstable senior estimates to flip the trends that we've seen. And they use their faulty age standardized estimates in testimony to endorse employer mandates. So I know of a couple of cases where the director of the science table, Peter Uni, he testified on behalf of the city of Toronto against the Firefighters Association and also for the Toronto Civic Employees Union. And he basically used these fudged numbers to endorse the workplace mandates. So there's some real consequences here. Now I'm going to look at hospitalizations. Oops, hospitalizations. So here we have on the left side, these are the raw incident hospitalization rates per 100,000 person days. And this shows that the unvaccinated rates were about double that of the vaccinated. Now remember, there's a lot of biases in these numbers. This includes biases due to selection bias, misclassification bias, underestimated population sizes. So there's quite a few biases. But the Ontario Science Table took the same underlying admissions data and they applied age standardization to the prevalence rates per 100,000 persons, and they get this. So suddenly the unvaccinated line, it shoots way up. And this orange line, it represents a counterfactual population that never existed and never could, and it amplifies such biases such as the healthy vaccinee effect. So the final bias that I want to talk about is this cumulative time-related biases. And you may recognize this type of table. This is this shows cumulative counts from December 2020 through to June 2022. So that's from the beginning of the rollout, the vaccine rollout onward. And so we see about 25,000 unvaccinated hospitalization versus about 12,000 vaccinated ones that are split across 3 groups. And the conclusion that everyone heard was that the unvaccinated are overwhelming hospitals. So this cumulative table, from a statistical point of view, has absolutely no meaning. But let's watch what happens when we split this exact period at the mandate passport line. So at the mandate passport line, so here on the left side, we have a pre-mandate period with low vaccination coverage. And here, almost all hospitalizations are unvaccinated by definition. So, and then you look at the right-hand side, and this is the mass mandate passport era. So at this point, about 70% of the population were at least 70% of the population were fully vaccinated, and we have the milder Omicron variant. So both these periods are about 9 months. So they're the same length of time. And the overall stats are fairly comparable between the 2 groups, despite the milder Omicron variant. That 6,300 figure is only about 1/3 of the total for the mandate passport period. So it paints a very different picture. And that number 6,300, that represents about 0.8% of total hospitalizations in Ontario during that period. And if we look at people under the age of 60, the COVID hospitalizations for that group, it amounts to about 0.25% of the total hospitalizations. And many of those, over half of those, are incidental. So to say that that group is overburdening the healthcare system and putting it over the limit, that is scapegoating. And it's very difficult for me to interpret their previous table as anything other than deliberate misdirection to justify restrictions. So that's all 7 biases. And every single vaccinated versus unvaccinated comparison that you ever saw was built on these. So now you probably understand how comparisons were unreliable from the moment they started pushing them. But the data didn't just become unreliable, it eventually became politically impossible. So I'll show you what happened when the biases could no longer hide the truth. And here we'll look at the COVID-19 case timeline again for the vaccinated and unvaccinated. And this covers from, again, the summer of 2021 to March of 2022, after which they stopped reporting these statistics. So they started reporting cases by vaccine status around the time that Trudeau called the election, and he started ramping up his rhetoric against the unvaccinated. Upon election, he kept true to his threats. He brought in the vaccine mandates and the travel restrictions. And then boom, with about 80% of the population fully vaccinated, we see a huge increase in the number of cases, and that's dominated by the vaccinated. But they did not relent. Instead, they doubled down on the narrative that it was due to the unvaccinated individuals, and they even brought in additional restrictions on unvaccinated truckers, which of course sparked the Freedom Convoy. But from a statistical perspective, or the data perspective, This is a period of desperation. We have a big narrative fail. So we can see why they had to stop reporting, and it also explains why they pivoted to 100% simulated models. Basically, the real-world data had become lethal to the narrative. Now, in April of 2022, just 2 months after they unconstitutionally invoked the Emergencies Act to quell vaccine mandate protests, the Liberals stood up in the House of Commons and waved around a 2022 simulation study by Fisman to extend travel restrictions. And what this study did is it retroactively claimed that the unvaccinated posed a disproportionate risk during Omicron, something that had already occurred, and they had real-world data saying otherwise. So how did they go about doing this? So here's that period. This is the real-world data during the Omicron wave, COVID-19 cases. So Fisman and his colleagues basically concocted a model to simulate fake data that fake data that basically, sorry about that, fake data that basically flipped the data. So they flipped the trends, and then they attempted to pass off these inverted trends as a true reflection of what actually happened. So that was the Fisman study, and this was cases. So in the next slide, we'll see what happens with case rates. Oops. I'm having a little trouble with my clicker today. Sorry. So here is the real Ontario data, and we have that the vaccinated had higher case rates than the unvaccinated, and Fisman's simulated model basically flipped that upside down, inverted the trend, and they used this fake simulation to claim that the unvaccinated posed a disproportionate risk to others. And the media took this study, ran with it. We've seen news headlines all across Canada and internationally warning of the risks of merely hanging out with unvaccinated individuals. And as I mentioned, this study was waved around in Parliament to justify extending travel restrictions. Now, recall what we showed earlier with hospitalizations. We also had an issue with hospitalizations falling when Omicron hit. We had hospitalizations doubling, and we also, if you look at the counts, the counts were led by the vaccinated population, as I showed in the previous table. But what happened is that Teresa Tam and her colleagues, they actually came out with a study. So, and their study claimed that, well, you know what? It would have been worse. If we hadn't brought in all these restrictions and all and the vaccines, we would have saw more cases, more hospitalizations, more deaths. And they did this with a counterfactual what if simulation that was complete and utter make believe. And under their counterfactual study, they say that, well, we averted an extra 30 million cases. Instead of seeing 3.3 million cases, we would have seen up to 34 million. Instead of 150,000 hospitalizations, we would have seen 2 million, and we would have seen up to 800,000 deaths. This is a very absurd study. So basically, they went in the beginning, they promised to see reductions in hospitalizations and cases. We didn't get that. So their story became, well, you know what? It would have been worse. And they basically made up models to make those claims. And if you look at this date is the observed as of April 24th, 2022. Remember, the Fisman study was also published in April of 2022, the end of April. And this was the period where the federal government was desperate to justify why it was keeping in the travel restrictions and the mandates. So basically, I walked you through my preprint. I use 100% official Canadian public health data. It's their reports, their dashboards, and their footnotes, nothing else. And it shows that the evidentiary standard wasn't just bent, it was completely abandoned. So if you haven't already, I do ask that you download the preprint. I have the link here and I'll put it in the chat afterwards. But I think it's very important to download this link, share this link, and the more this is known and used, the more likely I think we are to move towards accountability. And my book, Fisman's Fraud, The Rise of Canadian Hate Science, this book began with one paper, the Fisman modeling paper that deliberately scapegoated the unvaccinated. That single act of hate science proved they would go to any length, including blatant scientific fraud, to strip Canadians of bodily autonomy. So when real-world numbers finally collapsed the narrative, they didn't retreat. Instead, they doubled down, and every one of these institutions on this slide, they all defended that study, even when they were sent proof that it was false and fraudulent. They refused to make corrections. So the preprint, along with this book, together, they are the smoking gun. It shows they never had the evidence. They knew it, so they fabricated it. And then I'll end the presentation with this slide. 3 pillars kept this entire mandate regime standing. The follow the science. This is a statistical house of cards that I just dismantled with their own numbers. The controlled communication and censorship was the only thing that let such basic flaws persist and drive behavior. And courts that claimed they were deferring to public health expertise and following the science, they were not. In fact, they were actually deferring to political direction and, in doing so, putting public health itself at risk. So we now have the evidence to completely shatter pillar number 1, and without it, the other 2 become indefensible. So I covered a lot today. That said, that's really just the tip of the iceberg. There's a lot more to cover for each of these 3 pillars. I know that you guys have recently put out an excellent report written by Nigel Hannaford, and it talks about the behavioral science nudging. There's a lot more that can be said about that. And also there's a lot that can be said about how the behavioral science actually factored into the science. There's a lot of evidence that the behavioral science actually fed the modeling instead of the other way around. And also, of course, you guys are very familiar with the legal game that's been played. So I'm going to end it there. I thank everybody. I will put my contact information in the chat. You can follow me on Twitter, and I also have a Substack. And just a note that this is completely independent, unfunded research. My main objective in doing this isn't like I do think it's important for people to understand what went on, but my main objective when I do research isn't necessarily to wake people up. What I'm trying to do is provide like basically evidence that can bring about accountability. I want evidence that can be used basically in court and be used to hold the government to account. So one of the biggest issues we had, and this came out, for example, in the Alberta report, Alberta put out a task force report that was, I think, published in January of this past year. And the conclusion was basically the government did not have evidence for the lockdowns or a lot of the measures that it did. The issue, of course, was that the people who you have a lot of people saying, well, there's all these reports that basically said we did the right thing. So unless we tackle that huge body of information and we take down that huge body, I don't see us winning. They will always hide behind it. What this preprint does is it actually systematically destroys that evidentiary foundation. They have nothing. They have always had nothing. And basically, that's what I'm trying to show. And I can show because they have had nothing. And it is obscene that they got away with it because the flaws that I point out is like statistical kindergarten. The only way you can get away with this kind of thing is under extreme censorship, which is what we had. And anybody who calls themselves an expert would have or should have known that this data was completely and utterly unreliable. So really, that's my main goal. And that's also why I have submitted this preprint to a peer-reviewed journal, because I'm hoping that if it gets published in a peer-reviewed journal, it'll be easier to just bring it into court and help all you folks out. So that's what I'm really hoping. I didn't think there was any real possibility of getting this published in Canada. I did go head to head with a lot of the institutions when I was trying to get Fisman's study retracted. And the amount of pushback was immense. They had no intention of correcting the record. Indeed, when the Canadian Institute of Health Research received all this information, they continued to fund those researchers, and those researchers continued to put out even more fraudulent studies, including a faux masking study. So clearly, they're not backing down. The University of Toronto, the same thing. And these researchers went on to update their model and double down on that narrative that it was the unvaccinated. So there's no movement here. So that is why I submitted my journal to an international, I submitted my preprint to an international journal, hoping that going outside Canada will help get this published. And that said, the more interest that people show in my preprint and the more people discuss it and the more they take this as fact, then the more likely it will get published and faster. And the reason why I say fact is I went about this a specific way. I went about it by looking at what public health reports themselves said, what our official public health agencies actually wrote down. So they really cannot squirm out of it. This isn't my interpretation. It's not my analysis. It is their analysis. It is their corrections. It is their footnotes. So I think this is